Hello, everyone, to this special Facebook Live session on the occasion of World Hypertension Day. Today, we gather here to raise awareness about the silent but significant threat of hypertension and its impact on our health. Hypertension, commonly known as high blood pressure, affects millions of people worldwide and is a leading cause of cardiovascular disease. It is crucial to understand the importance of early detection, prevention, and effective management of hypertension to lead a healthy and fulfilling life. To shed light on this topic, we have a distinguished panel of experts who will share their knowledge and insights. Allow me to introduce our esteemed panelists. So we have Dr. Saibal Chakravorty, a distinguished medical professional. Dr. Chakravorty brings a wealth of knowledge and expertise to our panel. With his vast experience and research work, particularly in the field of basal insulin, he has made significant contribution to the medical community. Next, we have Dr. Deependra Bhatnagar. With over 25 years of experience as a highly skilled cardiologist, Dr. Bhatnagar is an expert in various cardiac procedures and interventions. His extensive training and compassionate patient care make him an excellent choice for those seeking top notch cardiovascular care. Next, we have Dr. Arvind Singhal. He is one of the best senior interventional cardiologists in Faridabad. Dr. Singhal brings over a decade of experience in handling acute coronary syndromes and other cardiac emergencies. His expertise are at Metro Heart Institute with Multispecialty Hospital Faridabad. Next, we have Dr. Harnish Singh Bhatia. Dr. Bhatia is a highly experienced cardiologist with a strong background in cardiology. He practices at Metro Hospital and Heart Institute, RLKC, Pandavnagar, where he provides expert care to his patients. His specialization is in DM cardiology and adds to his vast knowledge in this field. Next, we have Dr. Ashwani Kumar Yadav. With over 19 years of experience in cardiology, Dr. Ashwani Kumar Yadav is renowned for his accurate diagnosis and excellent patient care. His qualification, including DNB cardiology and MD medicine, have earned him a reputation as one of the most sought after senior consultant in Metro Hospital and Heart Institute, Rewari. Throughout this live session, our panelists will share valuable information, discuss preventive measures, and answer your questions related to hypertension. We encourage you to actively participate as knowledge and awareness are the first steps towards a healthier life. Let's come together and embark on this journey of understanding hypertension as we strive to make a positive impact on our well being. So, join us for the informative and engaging discussion on the World Hypertension Day. So, my first question to Dr. Saibal, so what is hypertension?
We all know, first of all, I salute you, especially setting up this Facebook Live program on this World Hypertension Day. So we all know that hypertension is a special non-communicable disease, which is very common in our country. However, the adequate of this in our public and day-to-day health has been given. We simply do not consider as a public that it is a disease process. We commonly link it with the word tension, and majority of the people say this is because of the tension that the blood pressure has gone up. So blood pressure as a disease definitely do exist, and we all have to take care of this disease since it's a part of a total spectrum of metabolic disorder. So hypertension as a disease, as we go with the flow of the program, definitely will deal more. Go ahead, please.
Sure. Thank you, sir. So, my next question to Dr. Ashwini. Sir, what are the common misconceptions about hypertension and how can we address them?
So the common misconceptions is that it is a disease which no one knows. Even the patients might have this disease without any symptoms. So patients might be fear of the many disease and misconceptions. First misconception is that it does not cause any harm. Slightly raised blood pressure might not cause any harm to me. Why I should take treatments? So it is the most common misconceptions everyone has, that even there is a slightly 140 by 90 blood pressures, it does not cause any symptoms at a very early stage. but later on it leads to the slowly damage to the heart and blood vessels, and atherosclerotic changes they get accelerated in the presence of hypertension. So first common misconception is about the disease per se, is that patients might be not aware of disease and they may neglect this. Second is about the treatment. Most of the patients, they think that this hypertension is not a disease, and we also know it is
Alright.
not a disease directly or indirectly, but it is ultimately linked to almost every comorbid conditions, because it might leads to the more damage to uh, in the presence of other comorbid disease. So patients might neglect and have misconception about this treatment also. Third is about the various this blood pressure parameters. The patients might not take treatment that because of the fear of side effects of the many drugs. That this drug may cause many symptoms and all these, because nowadays with the advanced science, this Google is very common symptoms that patients read all these symptoms and side effects of the medications. So these are the diagnosis, treatment related, and comorbidity related misconceptions about the disease.
Oh, thank you, sir. So my next question to Dr. Arvind. Sir, can you explain how hypertension affects the body and why it is important to manage blood pressure levels?
Basically, hypertension is the silent killer. It affects all organs of the body. Majorly, it affects the vessels, cardiovascular system, which can lead to coronary artery disease, atherosclerosis, heart failure, brain stroke, renal failure. In the eye, this can lead to blurring of the vision and retinopathy, and it also affects the vasculature, which can lead to peripheral vascular disease. So important to control the blood pressure. The control of the blood pressure is very important in every person. The target lesion of the blood pressure is the ideally 140 by 90 in every age group. That is the more than 18 year of the age. Various guidelines recommend target BP is the 150 systolic and 90 diastolic in age more than 60 year of age, and systolic BP 140 and diastolic BP up to 90 in the age group of the 18 year to the 60 year age. So, so blood pressure control is very important to prevent the complication in the heart patient.
Thank you, sir. So my next question to Dr. Bhatia. Sir, what lifestyle changes can help prevent or manage hypertension, such as diet, exercise, and stress reduction?
So, first of all, thank you so much for organizing this initiative on the day of World Hypertension Day. I'm sure it goes a long way in creating awareness in patients regarding the adverse effects of hypertension and how to control it. So, talking about the lifestyle changes, I would probably divide them into three groups of lifestyle changes which we need to bring in our lives to control hypertension. First is physical activity, second is diet, and third is stress reduction. These are the three main important parameters through which we need to manage our hypertension. In terms of physical activity, World Health Organization recommends 150 minutes of light physical activity every week, which can be divided into 30-minute sessions at least 5 days in a week, which can include simple walking, jogging, running, swimming, or even playing some mild sports. WHO also recommends including at least 2 days of strength training in this program, and because strength training also reduces blood pressure by 8 to 10 millimeters of mercury. Talking about diet, we need to take diet which is low in sodium and rich in potassium. Sodium intake should be reduced to less than 5 grams per day, preferably to less than 2.5 grams per day in patients who have family history of hypertension or who are already diagnosed with hypertension. A DASH dietary approach to stop hypertension is very effective in reducing hypertension in patients who have already been diagnosed with hypertension. So mainly our diet should be rich in fibers like fruits, vegetables, low cholesterol dietary products. These go a long way in reducing hypertension. Third, stress reduction is very important. As we have seen in recent times, young patients have been diagnosed with hypertension quite a lot who have never had a family history of hypertension and no other risk factors for hypertension. So stress is a major factor which has increased in recent days. So stress reduction, taking adequate sleep, fixing your sleep schedule, going to sleep and waking up from sleep every day almost at the same time, not having irregularities in that, this goes a long way. Reducing smoking is a very effective. Smoking as well as alcohol. They are very important risk factors for hypertension. So try to reduce completely stop smoking and reduce alcohol intake to at least not more than once a week or twice a week. That too in moderate amounts. And lastly, home monitoring of blood pressure is very effective in patients who have any symptoms of hypertension or who have doubts about having hypertension. They should have at least a home BP monitor to check their blood pressure. So these are the lifestyle modifications which I feel are required in each and every individual, especially those who are having a family history of heart disease or hypertension or who are having symptoms of hypertension.
Thank you, sir. My next question to Dr. Deependra. Sir, what are the some of the challenges of managing hypertension, both for patients and for healthcare providers?
Yes, good afternoon, everybody. It's very important to understand from physician and cardiologist point of view that single drug cannot always control the blood pressure. And for any adequate control of blood pressure, you need to first have information about three things. What is the creatinine level of the patient, whether he is diabetic or CAD is present or not, and what are the any associated factors like bronchial asthma, peripheral vascular disease, or anything. And what importantly, any blood pressure should have reading of pulse also. So any tachycardia, if you don't control the tachycardia, heart rate of the patient is still high. He may be having, he may be taking 4 drugs. Still, the blood pressure cannot be controlled to target levels. So always see what is the pulse of the patient, what is the blood pressure of the patient, what is the creatinine level, diabetes, asthma, peripheral vascular disease, and lastly, any associated CAD or not. Then you start with the one drug, and it's important to educate the patient that 2 drugs should be taken at different times. Sometimes what happens is they take both the drugs in the morning, and next time the evening blood pressure is again on the higher side. And many of the patients, they have very early morning. Most of the patients may have early morning surge of blood pressure around 6 a.m. or so. So at that time, most of the cardiac or cerebrovascular events can happen. So one drug should be taken in the morning, and next drug should be taken in the evening. And similarly for the patient and for the physician and the cardiologist, they should target both the things. That is, target heart rate. Heart rate should be brought to less than 90 or around 80 or something like that, and target the blood pressure also, keeping in mind the associated conditions like diabetes, kidney disease, or CAD or bronchial asthma. Then they can select 1 or 2 drugs, or they can go to combination of third or fourth drug, and that's how they adequately control the drug, along with the lifestyle modification, reduction of salt. And another very important message is it's never a no salt diet. What happens is patient just stop eating salt altogether. That is very wrong conception कि मैं नमक बंद कर दूंगा तो मेरा बीपी ठीक हो जाएगा. This is a very important thing, very important message, that they should have low salt diet. They should not stop intake of the salt, the extra salt, that is extra table salt in the form of salted biscuits, salted snacks, that has to be withdrawn, and they can continue to take routine or less salt in their vegetables or cooking salt. That can be taken. So low salt diet plus adherence to medications in a proper time and proper doses, that is very important. And keeping in mind the associated conditions like kidney, heart disease, blood pressure, diabetes, and asthma. So that's how we can select the better drug, and patient should have proper compliance and regular visit to the doctor so that blood pressure can be controlled to target levels.
Okay, thank you, sir. So next question to Dr. Chakravorty. Sir, are there any new developments in hypertension research or treatment that people should be aware of?
So overall, if you see, the technology has simply revolutionized the treatment of all the non-communicable diseases these days. We do have several newer modalities in the form of various newer technologies to monitor these patients, to prescribe medicines. We do have a lot of newer instruments available with us. If we see the monitoring of these patients, most of the patients Previously, what used to be done is that the patient comes to the doctor's chamber, we check the blood pressure. Sometimes we find them on the higher side. Patient may say, my BP most of the times at home remains normal. In such a case, we were not able to decide properly whether to treat this patient or to leave it or just the lifestyle or the medicines. But nowadays, we have divided into three parts. One is the office BP. We check blood pressure of our own. Second is the home BP. We have electronic instruments which we can check at home. And the third one is ambulatory blood pressure monitoring. With the help of this particular instrument, we are able to monitor 24 to 48 hours the patient's. It is usually kept on the arm of the patient and the blood pressure gets recorded automatically. With the help of that, we are able to see whether there is a nocturnal surge of blood pressure is there or not. What is the level of the sympathetic drive in these patients? We can find out because we can monitor the pulse rate also along with it. So there are a lot of things we can do. And then finally, we can take a printout and keep it in front of the patient that, okay, these are your values. This is the time you should take the medicine. This is the way you should carry out your lifestyle modification. So overall, the technology has simply revolutionized the treatment these days. Now, we also have other instruments like in the form of app. There are various apps which are available, cardiovascular apps which are available these days. There are step counters available. We normally say you do 10,000 steps in a day. So step counters are available. With the help of that, patient can monitor themselves, how much they are actually exercising, whether they are following our guidelines or not. There are various questionnaires which comes in that, and they get answers to them also. The way the lifestyle is modified. There are various diet apps which are coming. So all these are combined. We are definitely much more empowering the patient, in fact, to take care of their own health.
Thank you, sir. So my next question to Dr. Ashwini. Sir, can you share any personal experience or story of a patient who has successfully managed hypertension and what strategies they have used?
Yes. Uh, I have experience with the one patient's patient came to my OPD and having blood pressure of 260 by 160 every time, and he was taking four medications in a combination pills, and his blood pressure remains this despite all these four medications of three different groups. And every time he was complaining about this panic attacks followed by sweating, excessive sweating, and slightly for 2 to 3 minutes of unconsciousness. This was the history given by the patients came to my OPD about it was about 2 to 3 years back incident, and we have admitted the patient, and we have started the treatment to this by nitrates, and patients suddenly have hypotension. So we have stopped those things, and we have this that ultrasound was done, and there was some tumor suspected on ultrasound, that is adrenal some tumor. And next day we have sent the test of this plasma metanephrine and all these, and urine metanephrine level, and reports came after 3 days. So patients was here about for 6 7 days, and there was significant this raised metanephrine levels. We have also in the meantime undergone this MRI CECT abdomen, and it reveals the adrenal adenoma. So we have sent the patients to patient itself. We have suggested the patient some surgery, and patient itself gone to some private hospitals, and then return to me after 1 month. And patients give me very humble this thanks that my blood pressure now is controlled with only two tablets. It was not controlled. So you have this evaluated thoroughly. It was for last 20 years. He got this episodic symptoms of this sweating, headache, and this blood pressure remains of this. So it was this adrenergic tumor, adrenal adenoma. And if we by this, I have realized that if we thoroughly evaluate, because we know about 90% of the patients we do not get any cause, because there are only 5 to 10% patients we identified the cause. Rest patients may not be able to find the cause. So those 5%, if they are diagnosed and treated, so we can save their lives by diagnosing and treating the definitive identifiable disease. In these patients, it was the adrenal tumor, because these patients have adrenal surge every time, got panic attacks, and his blood pressure shoot up to 300. So it was, the cause was treated, that is adrenal adenoma excision, and he got relieved with, and now his blood pressure is only uh, controlled with the only single pills in dual combination. So that was my clinical experience. It was very good to, then I realized that we should investigate each and every hypertensive patients thoroughly by keeping in mind the identifiable cause.
Thank you, sir, for sharing your
Mr.
experience.
Afan,
Yes, sir.
there is a question which has come. Can we rely on smartwatch ECG? So the answer to it, whatever I feel, so most of these smartwatches and these ECGs are rhythm strip only. So whatever is the rhythm disorder, yes, you can definitely find out quickly. You can at least get a clue for it. But we need a 12-lead ECG most of the times to make a concrete diagnosis. So just on the basis, yes, all these tele devices, the smartwatches, and there are other tele devices, they are all mostly rhythm strip.
Thank you, sir. So before moving ahead, I would request all the participants who are joining us through different through YouTube or Facebook, they can ask their questions by typing it down on the chat box down below, and from there I'll take the questions and the expert will suggest the answer. So moving on to the next question. So Dr. Hanish, can you explain the different categories of hypertension such as stage 1, stage 2, and what the numbers mean in terms of blood pressure readings?
Sure. I think before coming to your question, I would like to add to the previous question which was asked regarding the smartwatches. So, WHO recommends only Apple Watch Series 7 or later, which is FDA approved for monitoring of the heart rhythm. That is just for heart rhythm. All of us need to understand that a smartwatch cannot diagnose a heart attack, because for that requires a 12 lead ECG, like Dr. Saibal has already told all of us. So this only arrhythmias it can diagnose, but that too not with 100% reliability. It can record the abnormal rhythms which need to be assessed by a cardiologist for further recognition of an arrhythmia. Now, coming to your question, the stages of hypertension. So, hypertension has been categorized into various stages by multiple organizations. So there are two such more important classifications. One is the European classification, and another one is the American classification. So according to the European classification, which came in the year 2018, hypertension is BP is divided into less than 120 by 80 is supposed to be normal BP, 120 to 140 systolic, and 80 to 90 diastolic is supposed to be pre-hypertension, and only more than 140 systolic and more than 90 diastolic is considered to be stage 1 hypertension, while more than 160 systolic and more than 100 diastolic is considered to be stage 2 hypertension. This is according to the European guidelines, while the American guidelines are slightly more strict, which came in the year 2017. They say normal BP is same, one less than 120 by 80. Pre-hypertension is 120 to 130 systolic and less than 80 diastolic, while more than 130 is stage 1 hypertension. So 130 to 140 systolic and 80 to 90 diastolic is stage 1, while more than 140 systolic and more than 90 diastolic is stage 2 hypertension. So American guidelines are more stringent. Now, how do these guidelines differ to each other, and which one to rely on is a slightly challenging question. But I would like to quote a study here, the Sprint trial, which says that the lesser the BP you can control, even the Accord BP trial, the lesser the BP you can achieve, there is better reduction of the cardiovascular events, which is absolutely clear. However, there's a caveat to it, that the older, frail population, which have more chances of developing side effects to the BP medications like orthostatic hypotension, dehydration, in those BP targets can be slightly lenient. Like you can achieve a BP of more than 140 or even say 150 in some subset of patients, and still they'll do really well with them. But as much as possible in a normal population, the targets which you need to achieve for BP is less than 130 by 85. And if your BP goes above 130, you need to start taking antihypertensive treatments. Even though some people might disagree with this finding, but Sprint trial and Accord BP trial have definitely proven these findings, and they definitely say that BP less than 130 by 85 reduces cardiovascular events compared to the BP more than 130 by 85. So as far as number goes, numbers are really important, and a BP of 130 to 85 in majority of population, and in some population 140 by 90 is advisable to be achieved.
Thank you, sir. So moving on to the next question, Dr. Arvind.
Yes.
So how can we improve hypertension awareness and education in this community, and particularly among the high risk populations such as older adults and those with comorbidities? So,
We aware the general population via the social media and regular health camps. That is very helpful to aware the public about the significance of the hypertension and its complication. By the, also we can aware the public by the print media, health camp, and regular camp in the society, also in the hospitals.
okay, so moving on to the next question, Dr. Deependra. So, what are the warning signs or symptoms to look out for if someone suspects they may have hypertension, and what should they do?
Yeah, first of all, always remember hypertension is always even known as silent killer also. It is the tip of iceberg also, because underlying problems are always aggravated whenever there is a sudden rise in blood pressure. Many times, patient may complain of some giddiness, some headache, or some shortness of breath, or some palpitation, because along with hypertension, heart rate may also be high. So these are the common symptoms. They may have some headache, giddiness, some heaviness, or palpitation, but sometimes there may not be any symptoms. So most important thing is there if they are experiencing some undue fatigue, some dyspnea or breathlessness during walking, and even without any symptoms also, it's very important to educate people. Anybody who has got family history of hypertension, especially if they are above the 40 years of age, they should at least go for regular health checkups and get their blood pressure checked. But most of the time, always remember any symptoms of headache, fatigue, dyspnea, palpitation, or undue heaviness in any part of the body like chest, or any numbness in any part of the body, should indicate that there is something wrong. So blood pressure may be on the higher side. They should get their blood pressure checked and get properly treated.
Thank you, sir. So moving on to the next question, and before moving on to the next question, I would request all the audience to ask as much as questions they want to ask by typing it down from the comment box down below, and from there, our experts will answer your queries. So next question is to Dr. Chakravorty. Sir, is age a significant risk factor for developing hypertension?
Yeah, definitely age adds to one of the risk factors in hypertension. Now, normally we divide the hypertension into two parts. One is primary, which may be hereditary, or secondary because of any other causes. A young person can develop, and these days, young hypertensives are quite common. Most of these young hypertensives we have to investigate regarding the presence of any secondary causes. And as we age, definitely the level of blood pressure goes up, incidence of hypertension is also going up. So age may be one of the factors, but we have to investigate these patients regarding the presence of secondary hypertension also.
Thank you, sir. So next question to Dr. Ashwani. So why is it important to monitor blood pressure at home? And how can people do this effectively? Are there any specific devices or techniques you would recommend?
Yes. Because hypertension, we know that there are various categories of hypertension. Some of the patients who visit the clinics, they might have high blood pressure by in the office blood pressure that is high, but at the home they might have no symptoms and even blood pressure is also normal. So to rule out these conditions, we call as white coat hypertensions. These patients usually have hypertension in the hospital setup, but they have normal blood pressure at the home. So they usually require the some sort of monitoring. So that is the ambulatory blood pressure monitoring and mean blood pressure monitoring. So in that subset, we can uh, have this ambulatory blood pressure monitoring at home. Second is the self monitoring of blood pressure is also advised. This ambulatory, because it requires at least 24 hours of blood pressure monitoring, we put the device and ask the patients to come after 24 hours, and that devices take electronically the blood pressures and we get transferred and analyzed on the next day. Second is the home monitoring of blood pressure by itself is also advised. So for that, we have specific certain devices. We should use the standard devices recommended by the WHO. One of the devices and common, this is the Omron, this company that is advised. Second is important as we should use the recommended device. Besides that, also use the some appropriate standard reading while taking the blood pressures. First is there is a standard method to measure the blood pressure is that patient should this have at least 5 minutes of rest if he walks from somewhere outside before taking the blood pressure. Second, there should be the bladder should be empty. He should not be in a hurry and in an anxiety state. Third is if while we're taking the blood pressure, this adequate size of cuff should be there, and the cuff size should be at least upper. It should fill up the upper arm of the patient's 2/3 of the upper arm. Third is fourth is the device we use as automatic. We ask recommend the patients to use the automatic device. So monitoring the blood pressure by these available electronic devices, uh, cuff as well as this device, the level should be at the level of heart. If the device is higher than heart level and lower than, so blood pressure reading will be altered. So the proper techniques and proper this devices recommended device should be advised to monitoring the blood pressure at home by the self monitoring blood pressure.
Thank you, sir. So, my next question to Dr. Arvind. Sir, how does hypertension impact the heart and other organs such as eyes or kidney? And what are the warning signs or symptoms that people should be aware of?
Yeah. The hypertension affect the major organs in the body. First, we go through the one by one. First, there is the heart. Hypertension increase the stiffness of the vessels and increase atherosclerosis, which can lead to heart attack and the heart failure. When going to the kidney, it affects the microvasculature of the kidney, which can lead to renal failure. When go to the stroke, there is the increased risk of the brain stroke, especially in the intracranial hemorrhage. In the eye, it can lead to the blurring of the vision, retinopathy, and loss of the vision. In peripheral vascular disease, it can lead to the stiffness, stiffness of the arteries and lead to peripheral vascular disease. The majorly these organs is the affected by the high blood pressure. Primary aim to control the blood pressure. When the patient develop high BP, they develop symptom of the various organs. In heart related symptom is the patient develop breathing difficulty, in the chest heaviness. In patient develop headache, which can early sign of the neurological complication. Patient develop blurring of the vision, that is the early sign of the eye involvement in the high blood pressure. Patient develop peripheral edema and the swelling of the body, that indicate involvement of the kidneys. Patient develop claudication, that indicate peripheral vascular disease. These symptoms indicate involvement of the various organs in case of the high blood pressure.
Okay, so thank you. And moving on to next question, Dr. Bhatia. So, what are the some common misconceptions about hypertension, and how can we debunk them?
Right, that's very important. Um, First of all, in our routine practices, we see patients who come up with excuses like, I do not have a family history of disease. How can I have hypertension? So, for them, they need to know that hypertension can very well originate in the first generation. You don't necessarily have to have a family history of hypertension. Second misconception is that hypertension is only seen in men, it's not seen in women. It is very well seen in women, and in fact, taking oral contraceptive pills increases the risk of having hypertension. Pregnancy increases the risk of having hypertension. Pregnancy Hypertension in pregnancy can lead to worse prognosis, worse outcomes of the pregnancy. It can lead to intrauterine growth retardation of the fetus. The child can have less body weight. It can lead to abortions. It can lead to many other complications. Thirdly, in females itself, if you have had hypertension in a pregnancy, the chances of having hypertension later in life increases. So these are a few things. Third thing is, some people feel that I'm not old enough, I cannot have hypertension. And we've discussed it enough that young hypertensives are increasing because of stress, because of physical inactivity, because of eating habits, because of increased sodium intake in the diet, everything. So there's no age bar as to when you can have hypertension and when you cannot. Even children can have hypertension. Then, uh, fourth thing I usually hear from my patients commonly is that I do not have any symptoms of hypertension. Why do I need to take treatment? So we have discussed the complications in detail. We know that hypertension is a silent killer. It may usually not come up with any symptoms unless it has a very high BP of say more than 180 by 120. So hypertension can be there. It can be silent. You may not have any symptoms, but you do require treatment because silently it is killing you from inside. It can lead to all those complications which we have heard so far. So hypertension definitely requires treatment. Another thing which I commonly hear from my patients is that I'll get used to the medicines. I do not want to take medicines because if I take it, I'll have to take it for my lifetime because I'll get used to it. So to them, I would like to tell that you're not getting used to the medicines. You're in fact reducing the complications. You have hypertension, you've been diagnosed with hypertension, you're going to have it. It might actually wean off over the period of time if you adopt good lifestyle, good diet, stress reduction, adequate sleep, and all of those things which you have heard. It may actually come down, but you will definitely require medicines as per your cardiologist opinion. You need to take them if you're needing it. Nobody's giving you any unnecessary medicine. So if you're needing it, take it. You're not getting used to them. Another thing which I hear commonly is that I was diagnosed with hypertension and my BP got controlled, and now I do not need to take any medicines. Now my BP is fine. No, that's not how it works. Your BP is controlled because you're on medicines. The moment you stop taking them, your BP is going to shoot up again. So unless your cardiologist advises you to come down the dosages of your BP medicines or stop them, you should not stop them on your own. So these are the common misconceptions which I see in my routine day-to-day practice. The patients come up with. So at the onset, I would say ki hypertension is a silent killer. Be aware of it. It is causing you harm from inside slowly. So the earlier you diagnose it, the better you treat it, the better it is. There is WHO data which says only 21% of hypertensive patients are adequately treated, which is very, very, very bad. And it can be even worse in India. In India, there's a data which says only 12% of hypertensives are adequately treated. They have adequate BP control, which is too bad. Like 1 in 10 hypertensives are adequately treated. So we need to uh, be more aware that treatment required is necessary. It's not unnecessary. You're not getting used to it. So these are the common misconceptions which I've heard from my patients.
Oh, thank you, sir. So my last question to Dr. Bhatnagar. So, are there any specific exercise recommendations or physical activities that can effectively lower the blood pressure?
Sorry, you wanted to know physical activities?
Yes, sir. Or
Which
exercises
addiction?
that can lower the effects of BP.
It's very important to realize, obviously, with the recent contest also, that any physical activity which is suitable to the person, depending on his cardiac condition and his overall health. Usually, we suggest them first of all morning walk of about 40-minute duration. That should be slightly brisk walk. No need of jogging, running, and even I would not advise running on a treadmill. With the recent scenario, we have seen many cardiac events happening just by excessive running on a treadmill. Patient cannot stop. Patient might be having underlying CAD or accelerated hypertension, which suddenly can lead to stroke or cardiac arrhythmias and sudden cardiac death. So, best form of exercise or activity is daily morning walk. It should be empty stomach of about 40 minutes duration, just going for 20 minutes and coming back. Apart from that, they can do some light activities like yoga or meditation, something like that, or some kind of sports, what they are used to that, like any badminton or anything, whatever they are playing. But any stressful activity should be avoided until unless they have got well controlled blood pressure and their cardiac status is known. Apart from that, apart from this, the lifestyle modification, what I would like to highlight in this session is we have seen many patients who are on standard drugs, like as per our physicians also, they keep on starting the drugs like ARBs or AC inhibitors, and along with that, other drugs are needed. These patients, if they don't know their potassium levels and their creatinine levels, it should be monitored by physician as well as cardiologists at regular interval, because any creatinine of more than 1.1, 1.2 can have underlying hyperkalemia also if the patient is taking ARBs or other group of drugs, something like that. Suddenly, we have seen many patients, even I remember 2 or 3 patients landing up with cardiac arrhythmias, and nothing was, even one CPR was there because of just hyperkalemia. And fortunately, we could save the patient because timely I could detect the rhythm problem on the monitor itself, because we don't have the evidence of all these things in emergency. So always monitor their creatinine, always monitor their potassium levels, and ask them to control the diet factors, and never advocate them to excessively intake of like something like coconut water and all these things, which can lead to sudden rise in potassium, especially in people who are on ARBs and if they have some underlying renal dysfunction. So diet, light form of exercises like morning walk, and strict adherence to their medication, and regular monitoring of their creatinine, cardiac status, and potassium levels. These are essential to save their lives, and as well as to save them from CAD as well as stroke and other complications.
So thank you, sir. That was the last question from my side. Now I'm taking those questions which have came through chat box or through the comments. So my first question is, so it is with Dr. Chakravorty. So I am
Yeah.
24 years old. I have been living with high blood pressure for the past 6 to 7 months. My doctor prescribed me medicine. It is helping me to keep my BP under control. But are there any permanent cures for high blood pressure? So this question you can see on your screen, sir.
Just a minute, please. How many is the screen? Yes, this is the screen. Okay, fine. So the first and foremost is the age of the patient. Is 25-year-old, and I have been having a high blood pressure for last 6 to 7 months. My doctor has prescribed me medicine and helping me to keep my BP under control. But are there any permanent cures for this high blood pressure? So first and foremost is that the patient is quite young, 25 years old, and is having blood pressure for last 6 to 7 months. The blood pressure must have been monitored several times. What we require at this stage is to find out, is there any cause for secondary hypertension? We must screen this patient for cardiac disease, for renal disease, or whether there's adrenal involved or there is a peripheral vascular disease. All these 3, 4 things must be excluded in this patient before we label this patient as a primary hypertension. Patient may be having a family history, but then we have to investigate these patients regarding the evidence of secondary hypertension. And if there are any permanent cures, yes, if we do find some cause for this, definitely we'll be wiser and helping the patient to get that level. But if saying that whether there is a permanent cure at this point without having sufficient investigation, it's very difficult. And if the patient is having essential hypertension, we may have to continue the treatment for lifelong.
Thank you, sir. So my next question to Dr. Bhatia. Sir, there is a question. Hello, doctor. I'm a 35 years old male. For the last few days, I have been suffering from high blood pressure. My BP generally remains 170 by 135, which is too high. I don't consume alcohol and I take good care of my diet as well. Please let me know what are the main causes of high blood pressure.
Yeah, so that's a very good question by Mr. Ravi Gupta. So the main factors, the main causes of high blood pressure are the ones which we've already discussed throughout this talk. They are physical inactivity, There are dietary factors. He's saying he's taking good care of his diet, but what does he mean by taking good care of diet? Like, there's a very big misconception about diets as well. Everybody thinks they're taking a very healthy and nice diet, but imagine, even if you're taking a small amount of, say, pickle or papad in our diets, that contains a large amount of sodium. Some of us are very deficient in potassium in our diets. Having less potassium can be really bad for your BP status. Then, unknowingly or knowingly, we all have poultry products, milk products, which are usually very high in cholesterol and fats. So these are, even though we feel we are having a good diet, we're not taking any sweets, we're not adding extra salt or anything, but even the diet which we're consuming every day has a lot of salt in it. So it is not unless we really know the nutritive value of what we're eating, it's not really a very good diet. He says he does not consume alcohol. That is a very good thing. Alcohol definitely increases the risk of having blood pressure. So does smoking. Caffeine, to little extent, does when it's taken in very high amounts, but a mild to moderate amount of caffeine intake does not increase risk of hypertension. Physical inactivity. All of us these days are highly physically inactive. We all our works involve sitting on the table and desks, and we barely do any physical activity. So, like we've discussed, you need to do 150 minutes of physical activity a week to have a adequate BP control. Diet, we need to take DASH diet or Mediterranean diet. I hope all of you can just Google it and you can find out what it includes. It includes mainly fruits, vegetables, low cholesterol poultry, and all of these things. Apart from this, stress reduction is very important. All of the working generation working in corporates these days are highly stressed. Getting adequate sleep. Most of us have very tedious working hours. We barely get any sleeps. So getting adequate sleep is very important, and living a stressful free life. So these are the main causes of hypertension because of which you may be having hypertension. And then in addition to this, these are the causes of essential hypertension. In addition to this, you can have secondary causes of hypertension, like the case which was discussed by Dr. Ashwani Kumar Yadav. It was an excellent case, found an adrenal adenoma secreting some hormones which are leading to high blood pressure. So if you're having any of those secondary causes of hypertension, only your doctor can screen them. So go to your doctor, go to your cardiologist, get screened. If you are having hypertension at a young age, there might be a secondary cause for it.
Thank you, sir. So there is a next question. So, Dr. Bhatnagar, there is a question. What regular test do you recommend for a person without any cardiac history and symptoms? Just as she just wants to know as a precautionary measure.
Yeah, that's very important. So, as we have the screening cardiac packages, usually we go for the basic blood tests like blood sugar, lipid levels, their thyroid status, and their creatinine levels. These are the four basic things. Apart from this, we go for ECG, chest X-ray, then echo, and if everything is normal, then treadmill test. These are the basic combination of tests, because people they sometimes if you see the corporate packages like in bank employees and other corporates, they usually don't include treadmill test. To my mind, this is very important, because any person who is healthy, who doesn't have any cardiac symptoms, his ECG and echo will be normal. And similarly, one single recording of blood pressure may not give you any idea. So blood pressure recording can be done by visiting your doctors at different times, because some people they can have evening rise of blood pressure. So their morning blood pressure may be normal. After taking salt and after daily exercise activities, they may have evening rise in blood pressure. So your blood pressure should be taken at different times during your regular visits to your physician, and regular tests like in the form of blood biochemistry, treadmill, echo, and ECG with X-ray, and including your creatinine, lipid profile, blood sugar, and thyroid status. Those are the important tests which one should go. And if they are normal, never stop at that point. That is very important, because we have people who continue to smoke. My treadmill is normal, everything is normal, I can continue to smoke. I need not to bother. My everything lipid is normal. I can continue to have uncontrolled diet. So after 1 year or 2 years, he may have CAD and he may have hypertension. So never stop at that point. If your tests at one point of time are normal, and if you have family history of CAD, family history of hypertension, and if you have labile hypertension, please check your blood pressure again at different time. Go to your physician, and if some of the tests are normal, even then, repeat them after an interval of 1 or 2 years, especially if you have family history of hypertension and CAD.
Thank you, sir. And well, that was the last question in the chat box. And before winding up this session, I would want a take-home message from all of you doctors in a very short and crisp words, like in a very बहुत ही छोटे message, take-home messages for the audience. So starting with Dr. Chakravarty, sir.
So hypertension is a significant non-communicable disease. All of us must take care. We all know that there are a lot of complications starting from stroke, heart attack, kidney failure. So before all these things happens, we have to do end organ protection. The earlier you do end organ protection, the better is your quality of life.
Thank you, sir. So Dr. Bhatia.
Yeah. So thank you for this live event. I feel people are very lenient about diagnosis of hypertension for some reason in India. First of all, they don't check their BPs regularly. Even if they check it, they do not take their treatments adequately. And even though they will not have any symptoms, they are going to have symptoms later on in life. And at that point of time, it will be very difficult to control them. Like they say, hypertension is a silent killer. You won't get any symptoms, but it is killing you if you're not controlling it well. So control your hypertension. Lifestyle modifications are really important. Your doctor can only give you medicines. He cannot come and make you walk. He cannot come to your home and take you for a jog, right, with him. So that you need to do yourself. You need to do physical activity. You need to control your diet. You need to take less stress and try to meditate. So these are the things which go a long way. Medicines are important, but these things are equally important. So take all the health lifestyle measurements, take your medicines properly, and control your BP. It will go a long way in helping you prevent lives of your loved ones. Thank you so
Thank you,
much.
sir. So Dr. Arvind, from your side, sir.
Thank you for everyone. The take-home message of the today discussion is the first thing is to measure, which is the theme of the World Hypertension Day, to measure the BP accurately. First thing, then you control it and live healthy life and live long life. This is the take-home message to the everyone. Thank
Thank you,
you.
sir. Dr. Ashwani, sir.
Yes, thank you for organizing this live session. So I think all things that have been elaborated by Dr. Chakravarty, Dr. Bhatia. So I would like to add that by briefing this session, hypertension, we should adopt the regular strategy, because most we advise the patients, even we don't adopt this strategy in our daily day-to-day life. So important, the strategy is that what Dr. Bhatia has elaborated: do regular exercise, at least 150 minutes in a week, 5 days a week, and take healthy fruits and vegetables, stop smoking, and limit the alcohol consumptions. And what Dr. Bhatnagar, which I have also realized that most of these patients, they stop salt at all. And I have seen about 50% of the patients land into the hyponatremia. They have symptoms of hyponatremia, hypertensive patients. Then I have asked, we have stopped all this namak at all. Then we have done sodium. It was 115 or 112 levels. They feel very thirsty, all these. So the important thing is that we should not cut down the salt at all. We should ask them to minimize the salt, not the fully cut down. That is very, very, very important problems we encounter in day-to-day practice. And the last thing is have a regular this health checkups also, so that this disease can be detected at a very, very early stage, so that the complications can be minimized. And also if advise this regular intake of medications, so that the financial burden also less and end organ damage can be prevented.
Thank you, sir. So Dr. Deependra Bhatnagar, sir, from your side.
यस, फाइनल टिप्स, कुछ दिल की बातें कहूंगा दिल से। तो पहली बात है, सबसे पहली बात है टेंशन नहीं लेने का। स्ट्रेस इज द मोस्ट इंपॉर्टेंट थिंग विच इज किलिंग इवन वी हैव। सो टेंशन नहीं लेने का। वी हैव यंग हाइपरटेंसिव बिकॉज ऑफ स्ट्रेसफुल लाइफस्टाइल। तो पहली बात, चेंज योर पर्सनैलिटी, avoid stress, and apart from stress, say no to smoking. That is most important thing which is killing our young generation is the smoking. Always no to smoking. Limit your salt intake. limit your activities, like regular some activities should be there, morning walk or something. Just do whatever is your choice. Keep yourself healthy, regularly visit your doctor, and whenever required, go for the some test. And for preventive cardiology, I always say there's one sentence: कि जितनी पतली कमर उतनी लंबी उम्र. This is the best preventive cardiology sentence you can have. You can cut down your fat, you can cut down your salt intake, you can cut down your fat intake, lipids, everything, and take regular medication. And remember single line: jitni patli kamar utni lambi umar. Wishing you all the very best, and hope you have healthy heart and a normal blood pressure, and you can have a normal and very healthy life, long life. Thank you very much.
Thank you, sir. And thank you all for joining us today for this insightful Facebook Live session on World Hypertension Day. We hope that the knowledge and perspectives shared by our esteemed panelists have empowered you to take proactive steps towards maintaining a healthy blood pressure and a strong heart. Remember, hypertension is a silent enemy that can have severe consequences if left unchecked. By understanding the risk, adopting a healthy lifestyle, and seeking timely medical advice, we can effectively manage and prevent the complications associated with high blood pressure. And I would like to express my heartfelt gratitude to the panelists, Dr. Deependra Bhatnagar, Dr. Arvind Singhal, Dr. Harnish Singh Bhatia, Dr. Ashwani Kumar Yadav, and Dr. Saibal Chakravorty for sharing their expertise and dedicating their valuable time to this important cause. Your insights have truly been enlightening and have provided us with a deeper understanding of hypertension and its management. And stay informed, stay proactive, and let's continue to spread awareness about hypertension throughout the year. We look forward to your continued participation in our future events and initiatives. Wishing you all a good health and a strong heart. Thank you, everyone.
Thank you very much. Thank you.